class, my name is Erica, and my disease that I research is Bordetella pertussis. Etiologic agent: Bordetella pertussis, cause of epidemic pertussis, and the usual cause of sporadic pertussis. Bordetella parapertussis, occasional cause of sporadic pertussis. Bordetella holmesii, bacteremia in immunocompromised hosts. Bordetella bronchioseptica is common in animal pathogen. Reservoir: it is a human disease, no animal or insect source, no vector known to exist, and Bordetella pertussis is very contagious. Morphology and features: pertussis is a small gram-negative coccobacillus, obligately aerobic, non-motile, and it is fastidious. Virulence factors and mechanism of infection. Virulent strains possesses a capsule. The bacteria attach only to ciliated cells in the trachea. Pertussis produces many toxins, and the first toxin is pertussis toxin, and it contributes to bacterial binding of cilia, causes lymphocytosis, and impairs chemotaxis, and enters the bloodstream. The next is adenylate cyclase toxin, and it inhibits phagocyte and NK cell functions. Tracheal cytotoxin, it inhibits DNA synthesis and promotes cell death, and it is responsible for damage of ciliated cells. The last is filamentous hemagglutinin and pertactin, and it's attachment of epithelial cells. These toxins are poisons which cause damage to cilia and airway to swell. This produces the coughing. Pertussis is primarily a toxin-mediated disease. Bordetella pertussis can cause also severe bacterial pneumonia, and Bordetella pertussis, also known as pertussis or whooping cough. Pertussis is an acute infectious disease caused by bacterium Bordetella pertussis. Pertussis is derived from the Latin word per, which means thoroughly, and tossis meaning cough. It is primarily found in children and can be life-threatening for babies under a year old. Signs and symptoms: there is clinically 3 stages, and the first stage is catarrhal, and the early symptoms can last for 1 to 2 weeks, and they usually include a runny or stuffy nose, low-grade fever, a mild and occasional cough. Babies do not do this. Apnea, which is life-threatening, pause in breathing, and cyanosis. It's when you turn blue or purple, and this is pretty common in babies and young children. In its early stages, whooping cough appears to be nothing more than the common cold. Therefore, doctors often do not suspect or diagnose it until the more severe symptoms appear. Stage 2 is paroxysmal, and 1 to 2 weeks after the first symptoms start, people with whooping cough may develop paroxysms, which is a rapid, violent, and uncontrolled coughing fits. These coughing fits usually last 1 to 6 weeks, but can last up to 10 weeks. Coughing fits generally get worse and become more common as the illness continues. These coughing fits can cause people to make a high-pitched whoop sound when they are finally able to inhale at the end of a coughing fit. Vomit may occur. Feeling very tired after the fit can also occur, but usually seem well in between the coughing fits. And sometimes people struggle to breathe with these coughing fits. Stage 3 is convalescent. It is the recovery from whooping cough. The recovery from whooping cough can be slow. The cough becomes milder and less common as you get better. Coughing fits may stop for a while but can return if you get other respiratory infections. Coughing fits can return many months after the whooping cough illness started. Transmission. Pertussis spreads easily from person to person via direct contact. Person who is infected coughs or sneezes, they release small particles with the bacteria, and that is known as droplets transmission. Contact with contaminated formites, so if they touch a countertop and it's contaminated with bacteria on it. Pertussis is primarily found in children. People can be contagious for weeks, can spread the bacteria from the very first symptom and for at least 2 weeks after coughing begins. People have mild symptoms or don't know they have whooping cough can still spread the bacteria to others. Treatment. It is best to treat pertussis during the first week to 2 weeks before coughing occurs. Early treatment is most effective for reducing symptom severity. Treatment is ineffective if it started late of illness. Hospitalization is especially common for infants less than 6 months old. Respiratory support such as supplemental oxygen or even mechanical ventilation may be necessary for severe disease. Antimicrobial are given for treatment for individuals with confirmed or highly suspected. Antibiotics do not alter the course of the illness or prevent transmission if they are given later in the course of illness. Antibiotics that are given are azithromycin, clarithromycin, and erythromycin. And it's best that you get plenty of rest, drink lots of fluids, stay hydrated, and take antibiotics as needed. Lab diagnosis. To detect a whooping cough, there are tests that can be done. A sample can be collected from a person's throat or nasal to have it cultured. And one of the tests is a PCR test, which you get the results immediately, but it varies in the specificity. And the second is a test is a culture. It's sent to the lab, but the results do take 7 days, and it has better specifics for that testing for pertussis. Blood tests can be drawn and sent to the lab to check for white blood cell count. The white blood cells help to fight infections such as whooping cough. A high white blood count usually indicates presence of a type of infection, and it's a general test but does not check specifically for whooping cough. A chest x-ray can be taken to check for the presence of fluid in the lungs or inflammation, and this can occur when pneumonia complicates whooping cough. Prevention. The best way to prevention is to get vaccinated. Vaccines are available for babies, children, and adults. Babies and young children get their first dose of vaccine between the ages of 2 months, 4 months, 6 months, and between 15 through 18 months and 4 through 6 years old. And it's a total of 5 shots. Younger children get the diphtheria, tetanus, and pertussis, and this one's known as a DTaP. Older children, age 11 through 12 years old, get a single dose of tetanus, diphtheria, pertussis, and that is a Tdap. Adults aged 19 through 64 years of age get a booster of the Tdap every 10 years, and it's recommended that women get a vaccine between 27 and 36 weeks gestation, and this may help protect the infant during the first few months of life. Cover your mouth and nose with a tissue when you cough or sneeze. Wash your hands often with soap and water, or use sanitizer if soap and water are not available. Immunity. Pertussis has 2 vaccines available, the D-TAP and the Tdap. These vaccines both protect against diphtheria, tetanus, and pertussis. The vaccine contributes to an active immunity by providing us with a controlled way to create immune response. Humans produce active immunity and created by our own immune system when you are exposed to innate immunity or vaccine-induced immunity. Some fun facts. Pertussis is known as whooping cough because of the whooping sound that people can make when gasping for air after a fit of coughing, and you can review some of the other facts that I have here. And here are the multiple choice questions that you can review. There's 3 different ones. And that's pertussis. Thank you guys